a 40-degree curve in my back, and it's not getting any better, and the pain is only getting worse. I never have a day without pain. I'm suffering from a scoliosis in my left lumbar. I stay active. I try to do everything that I want to do, but I have a low-level chronic pain all the time and flare-ups often. More getting worse as I get older. I tried traditional crack, getting adjustments every week, chiropractic, electric stim, tried traction. I went to a week-long workshop where I got traction every day, 3 times a day for a week. And the pain has gotten worse, like I was just saying. I've tried aerial yoga, yoga for scoliosis. I use wedge pillows and do a lot of exercises that puts my spine in the opposite position while I'm doing core work. I did try an adult brace for 6 months during the pandemic. A lot of decompression, hanging upside down. I had cancer twice. I had breast cancer, so I have a double mastectomy. I do take Synthroid. I take a thyroid medicine, but that was because I got radiation in my throat, so that knocked off my thyroid for a little bit, but it's not much. I've had my ACL done twice. I've had bunion surgery on the left side. Oddly feel completely mobile besides this isolated back pain that is in the same spot all the time. It's just better or worse depending on the day. The discomfort I feel is usually the same all the time. I can pinpoint the area. It's in my lower back where the apex of my curve is, and it is just anywhere from like a dull 2 to a 6 pain, and it never radiates or tings, no electricity, but it just gets bigger and what feels like bigger and harder. And like after, say, a massage or not intense workouts or like laying down a lot, it could, at best, it just feels like that area of pain is smaller and less painful. Right now, sitting is one of the worst positions, so it's definitely not feeling good right now. Sitting's the worst, and I drove here, so like after even just that 10-minute drive and us sitting for 10 minutes, driving is one of the worst positions, most sitting positions for me. I have 2 little kids, so I can't hold them for as long. When I'm like putting the baby down to sleep, like I just can't stand there holding her. My back, just the pain goes from the 2 to the 6 within 20 minutes every time, so I have to put them down. I never sit down in my house except dinner time. Haven't sat with my wife on the couch, and I can't tell you how long when we watch TV at night. I'm on the floor doing exercises, or then I just stay there to watch TV because it's just too painful to sit down or sit on any soft surface like that. Dishes, cooking, anything stand up and static, like a little bit bent over. Other than that, my life, I am able to do the exercises I've narrowed it down to, and I do that happily and healthily. Like walking is great, movement is great. Instead of, it doesn't keep me sedentary, so that is helpful. It's getting to the point, it's so chronic now, I feel like it's a bit of a mental thing. I'm distracted by it all the time. I'm always aware of it, and if God forbid I have to go to a movie or go on a long drive or whatever, do I have some Tylenol? Can I prop my seat up to make me more comfortable? It's just always on my mind, so that is a bit debilitating now, like all the time. Biking too long and running too long, things I shouldn't have been doing, so it was aggravating it. The 30s is when I've probably tried all the different treatments for the most part, or got a little bit more serious about it. And it was still, I would say, manageable. I don't know if even in my 30s I would say I had chronic pain. I would never put myself in that category, but certainly in the 40s it's only gotten worse. So I would consider it chronic. It's definitely the latter 40s is for sure. I've done all those other things, and I still walk around with chronic pain. So I'm just at a point where I'm willing to try anything. I need pain reduction. I mean, it'd be great if I could do some of my daily things like the cooking and the dishes and stuff like that without the pain. I wore an adult brace for like 6 months, and there was no movement. Ideally, my spine would be straight down my back, and I would have space there. I would be taller. It would just be stretched out. All that compacted area could just like untwist and go back up. That obviously would be a dream. I wouldn't be icing it all the time. I wouldn't worry about long car drives or watching a movie and stuff like that. Basic everyday things, yeah. I can feel this is the side that holds my back pain too. Gotcha, yeah. It just feels good to do it on this side. I just came in one session a couple of hours ago throughout the exercises that were intense and hard, which usually would hurt my back. And now I have 0 pain. At the moment, 3 o'clock on August 1st. Weird, very weird. Okay. Yes, I feel like slightly giddy because of it. Feels like elevated in my lower spine, and then my head also. After the Relief for Life program, I realized I can get a lot more mobility in my hips than I've ever been getting or trying to even get. A few ahas about keeping the abs tight in the right way while still breathing through exercises. I'm really looking forward to continuing it and see, back pain relief for life, right? Like, I'm here for the long term, this is amazing.
Even more pull back, pull, maximum effort, tighten the abs. Good, and circle all the way out. Open, 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 open. Good, and then forward. Good, and pull again.
I think the burden of not feeling the pain in my lower back is just such a lift off of everything.